Hey everyone, welcome back. Today we're going deep on a topic that's super important for all you future mental health nurses out there.
Trauma-informed principles and human rights-based care.
Exactly. We're going to explore how trauma, really impacts people's lives.
And how you as nurses can use this knowledge to make a real difference for your patients.
We've got some really insightful resources lined up for this deep dive.
Like, we'll be drawing from Bessel van der Kolk.
He's like the leading expert on trauma.
Yeah, and we've got NHS Scotland's guidelines on trauma-informed principles.
And get this, we're even looking at legal frameworks.
You know, like the Human Rights Act of 1998.
And the Human Rights Jersey Law 2000.
It's all about recognizing that responding to trauma isn't just best practice.
Yeah, it's about upholding those fundamental human rights.
Exactly.
Okay, so first things first, what exactly is trauma?
Right, we hear that word tossed around a lot.
So how is it different from, just having a totally stressful day?
Van der Kolk makes a really important point.
What's that?
Trauma isn't just the event itself.
Oh, interesting.
It's how your body, keeps reliving that experience even when the danger is gone.
So it's like your body is stuck in the past, even though your mind has moved on.
That's a great way to put it.
Wow.
He actually compares the impact of trauma on the brain to, get this, a cockroach brain.
A cockroach brain. I've never heard that one before.
Yeah, it's pretty wild, right?
So, are you saying our brains turn into cockroaches when we experience trauma?
Not literally, of course. But think about it. A cockroach's main goal is survival, right?
That's so?
Their brains are wired for these super fast reactions to threats.
Okay, I see where you're going with this.
So when we go through something traumatic, a similar primitive part of our brain kind of takes over. It gets stuck in this state of hypervigilance.
Always on edge.
Yeah, always looking out for danger, even when we're totally safe.
Like our internal alarm system is just, constantly going off.
Mm-hmm.
That makes so much sense. It explains why someone who's experienced trauma might overreact to things.
Right. It might seem like they're freaking out over nothing.
But really, they're still living in that past moment of danger.
And that fear response can have a ripple effect.
Oh, interesting.
It impacts people physically, mentally, emotionally.
So, what are some ways trauma can actually show up?
Well, Van der Kolk talks about three main brain systems that are really vulnerable to trauma.
Okay, let's hear 'em.
First, there's the reward system.
The reward system.
Yeah, it's the part of the brain that lets us feel pleasure, joy, connection.
Okay, yeah.
But trauma can mess with this system.
So then you don't feel happy anymore.
It can be really hard to feel those positive emotions.
Oh, wow, that must be so isolating.
It is, and often it's linked to stuff that happened in childhood,
Early trauma.
Exactly, if a child doesn't get those basic needs met, like love, care, attention.
That's their reward system doesn't develop right.
It makes them way more sensitive to trauma later in life.
That's heavy stuff.
It really is.
It makes you think about how much those early years matter.
Yeah, they shape how we respond to everything that comes after.
What's the next brain system?
All right, so then there's the memory system.
Okay.
We all know trauma can cause those vivid flashbacks.
The intrusive memories.
But it can also have the opposite effect on our everyday memories.
What do you mean?
Someone might remember the traumatic event in perfect detail,
Uh-huh.
but they can't remember what they had for breakfast that morning.
Oh, wow, really?
Yeah, everyday memories can become fuzzy and hard to access.
It's like their brain is prioritizing the bad memories.
Right, and that can make it really tough to learn new things, handle social situations.
Even just do normal daily stuff.
Trauma kind of creates these gaps and distortions in their memory.
Makes it harder to move on.
And lastly, we have the threat system.
Oh, right. The one that's always on the lookout for danger.
Exactly, and trauma can send this system into overdrive.
Back to the cockroach brain.
Kinda, yeah. They're in a constant state of hypervigilance.
Anxious, jumpy, can't sleep.
It can make it hard to relax, to trust people, to feel safe in the world.
So they might isolate themselves.
Yeah, it's common, yeah.
It really shows how understanding trauma is essential for mental health nurses.
Couldn't agree more.
We can't just treat the symptoms without getting to the root of the problem.
And for a lot of people, that root is trauma.
We have to see the whole picture.
And if we connect this to the bigger picture, it becomes clear that responding to trauma with empathy and understanding...
It's not just about good care, it's about those human rights.
Right, now you're getting it.
Okay, so that brings us to trauma-informed care.
This is where it all comes together.
So, in a nutshell, what is it? And why is it so crucial for us, especially as mental health nurses?
It's a shift in how we think about care.
Okay.
Recognizing that many, if not most, people we see in mental health settings have probably experienced some kind of trauma.
You mean like we could actually re-traumatize them if we're not careful?
That's the scary part. Even the things we think are helpful, like standard procedures.
That would be triggering.
Think about restraints, for example,
Oh, yeah.
for someone who's been through physical or sexual assault.
Being restrained could bring back all those horrible feelings.
Powerlessness, terror.
Even though we're trying to help,
It's a tough reality.
that's a really powerful example.
It shows why we need to be constantly aware of how our actions, even our words, might affect someone who's experienced trauma.
So it's not just about what we do, but how we do it.
Exactly, and that's where those 6 principles of trauma-informed care come in.
The ones from NHS Scotland.
Yep, they provide a framework for creating a safe and empowering environment for everyone.
I like that.
So principle number 1, seeing through a trauma lens.
What does that even mean, like, practically speaking?
It's about understanding just how widespread trauma is.
Okay.
And recognizing that trauma isn't always this big, dramatic event.
So it could be smaller things, too.
It can be subtle, woven into everyday experiences like, sexism or racism.
So even if someone hasn't been through a major traumatic event, they could still be carrying those smaller traumas with them.
Those smaller traumas can be just as impactful, and we have to consider that.
So seeing through a trauma lens means trying to see the world from their perspective.
Taking their experiences into account, trying to understand why they might be acting or reacting in a certain way.
It's like putting on a different pair of glasses.
It changes how we see everything.
That's a good analogy.
So instead of judging someone's behavior, we pause and ask ourselves,
Could this be a trauma response?
what might have happened to this person that's influencing how they're interacting with me right now?
It's about shifting from judgment to curiosity.
Exactly. And that leads us to principle number 2, safety.
Creating a safe space for them,
It's absolutely essential.
especially when they're already feeling so vulnerable.
It's not enough for us to think the environment is safe,
It has to feel safe to the person we're caring for.
which means we need to consider their individual needs.
What feels safe for one person might be totally different for another.
And we have to check our own biases,
Oh, that's a good point.
Like a busy, brightly lit waiting room might seem fine to us.
But for someone with PTSD, it could be really overwhelming.
All those people, the noise, the lights.
They're already on high alert, remember?
So we have to be sensitive to those things.
Okay, so we're seeing through a trauma lens, we're creating safety.
What comes next?
What else do we need for trauma-informed care?
Well, when you've got that foundation of safety,
Yeah,
trustworthiness and transparency are super important.
makes sense. If someone's been betrayed or felt powerless before.
They need that extra reassurance that they can trust us, that we'll be honest with them.
So like explaining things clearly, involving them in decisions,
Being consistent, keeping our promises.
building that reliability.
Which can be really grounding for someone whose life has felt chaotic and unpredictable.
Right, because trauma can really shake your sense of stability.
When we're trustworthy and transparent, we're kind of counteracting those past experiences of secrecy and manipulation.
So they can start to feel like they have some control again.
Exactly, and that leads us to principle number 4, which is all about
Collaboration,
and mutuality.
working together.
It's about acknowledging that the person we're caring for is the expert on their own life.
Right, we're not the experts on their experience.
We're partners walking alongside them on their journey.
Instead of telling them what to do.
Exactly. We're not here to dictate the path.
So it's about shared decision-making, giving them a voice, a choice.
Asking them what happened to you, not what's wrong with you.
And what matters to you.
Exactly.
This feels so connected to human rights,
It is.
respecting their autonomy and dignity no matter what.
And that respect for autonomy brings us to principle number 5, empowerment, choice, and control.
Giving them back that sense of control that trauma often takes away.
We want to help them reclaim their power
Helping them see their own strength and resilience.
by giving them choices, encouraging them to participate in their care.
So we're not just doing things to them, we're doing things with them.
It could be as simple as asking,
Do you want to talk about this now or later?
would you like to try this relaxation technique, or is there something else that works better for you?
Little choices, but they make a big difference.
They help rebuild that sense of agency.
That's really insightful.
And last but not least, principle number 6, resisting re-traumatization.
Okay, that one's pretty self-explanatory, right?
It might seem obvious, but it's something we have to be mindful of constantly.
Because even small actions can trigger past trauma.
Bring back those feelings of fear and helplessness.
It's not just about avoiding restraints. It's about being sensitive to all those subtle ways we might be replicating those unhealthy power dynamics.
Our language, our tone, our body language, even the physical environment.
It's a lot to think about.
It is, but it's crucial.
So we're always asking ourselves, could this be triggering, even if it seems harmless to me?
A good example is like standing over someone while they're in bed,
Yeah, that could feel really intimidating.
especially for someone who's experienced trauma.
By changing our position, we create a more equal and respectful dynamic.
These 6 principles really paint a picture of what trauma-informed care looks like.
It's about so much more than just the techniques.
It's a whole approach to care, a way of seeing the world.
But where do human rights fit into all this?
That's where things get even more interesting.
Oh, cliffhanger.
Stay tuned because in the next part of our deep dive, we'll explore those legal frameworks that underpin human rights in mental health care.
And how they connect to those trauma-informed principles we just discussed.
It's all about turning those principles into action, into real-world policies and practices that protect people's rights and promote their well-being.
Can't wait to dive into that. Okay, so we've covered a lot of ground on trauma and why trauma-informed care is so important.
Now let's dig into the legal side of things.
Right, like what human rights are especially relevant in mental health care?
Well, both the Human Rights Act 1998 in the UK
Uh-huh.
and the Human Rights Jersey Law 2000 in Jersey, they both outline some key rights.
That are super important for protecting people with mental health conditions.
Exactly. It's about ensuring their dignity and well-being.
And these legal frameworks, they kind of go hand in hand with those 6 principles of trauma-informed care.
They
Right?
totally do. It's like the law is backing up those principles.
Making sure they're not just good ideas, but actual rights that have to be respected.
Let's start with the right to liberty and security.
Okay.
This is a big one in human rights law.
Especially in mental health care, where you might have situations with involuntary treatment.
Exactly. Someone can't just be locked up or forced into treatment just because.
There have to be very specific legal reasons for that, right?
Absolutely. Usually it involves a serious risk of harm either to themselves or others.
That makes sense.
But even then, there's a whole process to make sure their rights are protected.
To prevent someone from being detained unfairly?
And to make sure any decisions about their care are, fair and impartial.
So it's not just about keeping people safe, it's also about respecting their right to make their own choices,
Their autonomy.
which ties back to that principle of empowerment we talked about.
Totally.
Okay, so what about the right to a fair trial?
That's another crucial one, especially when we're talking about involuntary treatment.
So anyone facing that situation has the right to a lawyer to present their side of the story.
And to challenge the decision in court if they need to.
It's about making sure their voice is heard.
That their perspective is taken seriously, even when they're in a really vulnerable position.
It goes back to collaboration and mutuality.
Exactly. Treating people as partners, not just, dictating what happens to them.
Okay, now this next one is a heavy one, but we have to talk about it. The right to freedom from torture and degrading treatment.
Ugh. Yeah, this is a right that has been violated far too often in mental health settings.
Especially given those power dynamics.
It's really disturbing.
But it's a right that has to be absolute, right? No exceptions.
No exceptions. People with mental health conditions deserve to be treated with dignity and respect.
Always.
And that means no abuse, no neglect, no inhumane treatment whatsoever.
And that doesn't just mean physical harm, right?
Right. It includes verbal abuse, humiliation, anything that makes someone feel less than human.
It's about creating a culture of respect in mental health services.
Where everyone feels safe and valued.
Okay, now let's shift gears a bit and talk about legal capacity.
This is where things get a little complex.
But it's a really important concept.
It is. Article 12 of the Convention on the Rights of Persons with Disabilities.
That's the CRPD, right?
Yep. It talks about the right of people with disabilities, including mental health conditions, to make their own decisions.
So it's about supporting people to make their own choices, even if they need some help along the way.
It challenges that old way of thinking where someone else just decides for them.
Like they're not capable of making their own choices.
Exactly. The CRPD promotes supported decision-making.
Where we give people the tools and support they need to make those choices themselves.
Even if they need help understanding information or communicating what they want.
This seems like a huge shift in how we approach mental health care.
It is. It's about recognizing people's autonomy and agency even when they're struggling.
So we're not just assuming someone can't make decisions for themselves.
We're empowering them to be active participants in their own care.
That can be challenging though, right?
It can. It requires us to let go of some of that control we might be used to.
To trust that Even when someone is going through a tough time, they're still capable of making choices that are right for them.
And sometimes those choices might not be what we would choose for them.
But it's not about us, it's about respecting their right to self-determination.
Absolutely.
Now, all this legal stuff might seem a bit abstract.
But it has very real implications for your work as mental health nurses.
It's the foundation for everything we do.
That's why it's so important to familiarize yourself with the specific mental health laws in your area.
Whether you're studying in Scotland or Jersey, those laws are your guide.
They set the boundaries for ethical and effective care.
So knowing the law isn't just about avoiding getting in trouble.
It's about understanding your responsibilities as a nurse.
And knowing how to advocate for your patient's rights.
Exactly. It's about making sure those rights are upheld in practice, not just on paper.
Okay, so we've talked about the impact of trauma. We've looked at the legal side of things, all those human rights.
Then now comes the real challenge.
Putting it all into practice.
How do we actually embody these trauma-informed principles in our day-to-day work as mental health nurses?
Yeah, how do we make sure those human rights aren't just words on paper?
It's about bridging that gap between theory and practice, bringing those rights to life.
Right, because trauma isn't a one-size-fits-all kind of thing.
Every person's experience is unique.
And how they respond to trauma will be different too.
Exactly. Some people might be really open about their trauma, while others might not even want to talk about it.
And even for the same person, their needs can change from day to day.
What felt safe yesterday might be triggering today.
That's why it's so important to be constantly assessing, listening, observing.
Meeting each person where they are in that moment.
Picking up on those subtle cues, like, are they agitated, withdrawn, making eye contact?
All those little things can tell us so much about what's going on inside.
And remember, trauma can affect people on so many levels.
Physically, mentally, emotionally.
It could show up as chronic pain, sleep problems, anxiety, depression.
Trouble concentrating, difficulty regulating their emotions.
And if we're not careful, we could misinterpret those symptoms.
We might think someone's being aggressive when they're actually just scared.
Or that they're not motivated when they're actually just overwhelmed.
And those misinterpretations can lead to interventions that actually do more harm than good.
Which is the opposite of what we want.
It just highlights how important it is to have that trauma-informed lens.
To see the person behind the symptoms.
So for all you future nurses out there, how can you start putting this into practice?
What are some concrete steps we can take?
Well, first and foremost, education is key.
Learn everything you can about trauma.
Read books, watch documentaries, listen to podcasts, like this one.
The more we know about trauma, the better equipped we'll be to help people.
And don't forget about those resources we mentioned.
Van der Kolk's work, the NHS Scotland guidelines.
They're packed with valuable information.
But knowledge is only useful if we actually use it.
Right, exactly. We have to take what we learn and translate it into action.
So in every interaction you have with a patient,
take a moment to pause and ask yourself a few questions.
How might this person's past experiences be influencing their behavior right now?
What can I do to make them feel safe and supported in this moment?
Am I giving them choices? Empowering them to participate in their care?
Are my words and actions potentially triggering?
Those simple questions can really change how we approach our work.
They remind us to be present, to be mindful, to be intentional.
And remember, trauma-informed care isn't just about techniques.
It's about our attitude, our approach.
It's about meeting every person with empathy and compassion.
Listening without judgment, believing their stories.
Validating their experiences, seeing their strength and resilience.
Being a source of hope and support on their journey of healing.
So as you start your careers as mental health nurses,
remember that you have the power to make a real difference in the lives of people who have experienced trauma.
By embracing these principles, by advocating for human rights,
you can create a more compassionate and healing world.
And the learning never stops.
There's always more to learn, new ways to grow.
So stay curious, stay engaged, keep challenging yourself.
Be the best mental health nurse you can be.
Your dedication and compassion can truly change lives.
And that's a wrap on our deep dive into trauma-informed principles and human rights-based care.
Thanks for joining us on this journey.
We hope you found it insightful and inspiring.
Until next time, keep learning, keep growing, and keep making a difference.